Understanding Schizophrenia. Lecture by Dr. Pius Lawan Wabba. Definition. Schizophrenia is a psychotic disorder marked by disturbances in thought, perception, emotion, and behavior, leading to a loss of contact with reality. People with schizophrenia may experience hallucinations, delusions, disorganized speech, and social withdrawal. It is a chronic mental illness that interferes with daily life, relationships, and overall functioning. Epidemiology. Globally, about 1% of the population is affected. The illness usually begins in late adolescence or early adulthood, between 15 to 25 years in males and 25 to 35 years in females. It affects both sexes, though it tends to be more severe in men. Schizophrenia occurs across all cultures and social classes, but recovery depends on access to care and community support. Causes and predisposing factors. The cause is multifactorial, involving genetic, biochemical, and environmental influences. Genetic. A family history increases risk up to 10 times. Biochemical. Dopamine overactivity and glutamate imbalance disturb brain signaling. Brain changes. Enlarged ventricles and reduced gray matter indicate structural defects. Environmental. Prenatal infections, birth trauma, and urban stress raise risk. Substance use. Cannabis, cocaine, and amphetamines may trigger or worsen psychosis. Signs and symptoms. Symptoms are classified as positive, negative, and cognitive. Positive. Delusions, hallucinations, disorganized speech or behavior. Negative. Flat affect, lack of motivation, social withdrawal, poor hygiene. Cognitive. Impaired attention, memory, and decision-making. Diagnosis. Diagnosis is clinical, guided by DSM-5 or ICD-11 criteria. At least 2 key symptoms must persist for 1 month, with overall disturbance for 6 months. Assessment tools include the Mental Status Examination, PAN-SS, and BPRS. Management. Effective care combines medical, psychosocial, and nursing interventions. A. Medical. Antipsychotics, haloperidol, chlorpromazine, risperidone, olanzapine, clozapine. Depot injections improve adherence. Regularly monitor side effects like tremors or weight gain. B. Psychosocial. CBT to manage delusions and stress. Family therapy to improve understanding. Rehabilitation and community support to restore function. C. Nursing. Build trust and safety. Promote medication adherence and self-care. Provide psychoeducation and maintain a structured environment. Prevention. Detect and treat early warning signs. Avoid drug abuse, especially cannabis and stimulants. Promote mental health awareness to reduce stigma. Ensure regular follow-up to prevent relapse. Conclusion. Schizophrenia is complex but treatable. With early diagnosis, medication, psychosocial therapy, and compassionate care, many patients can live productive lives. Every person deserves understanding and dignity, not stigma. Follow Wabbas TV for more.